Right. You all can see the screen, I suppose. Right. Um, so today I'm supposed to talk about medico-legal aspects of abortion. Right. So abortion, though it is um, almost prohibited in Sri Lanka, but we do see quite a number of abortion cases either in the clinical practice or at the pathological or autopsy setting, with women sustaining injuries and different complications and even end up in dying following unsafe criminal abortions. Right. So the main objectives or learning outcomes I would expect you all to know is to know the legal background of abortion in Sri Lanka. You don't have to know all the laws, but roughly what have been prohibited or considered as offenses in Sri Lanka. Then the two to define different types of abortions, including criminal abortion, so that you know what are the types of abortion and incidents that is medico-legally important. Then to be able to understand the possible outcomes of unsafe abortion, because most of the medico-legal cases or medico-legal interest in cases arising out of unsafe or criminal abortion. Four is to know the different methods and complications of criminal abortions so that you would be able to understand the possible signs and symptoms and everything that so be useful in doing a clinical examination or autopsy examination. Then particularly with regard to autopsies, to be able to formulate cause of death in a case of uh, death of a woman following criminal abortion, and also be able to do a proper medical legal management of abortion. Now, though the abortions are almost prohibited except for one single reason, uh, in the clinical setup, you might come up with women or adolescent girls presenting with possible abortions, but I mean, it's not mandatory that you report all these cases to the police, uh, because in law, so it is not, they have not made it mandatory that all the abortion cases that we come across to be informed to the police or to take legal action. But anyway, if we start getting a lot of cases from a particular area, then uh, we consider informing police, because that means a fact or criminal abortion is running right in the area. So about the definition, we'll be having two definitions. One is legal, which is important when you are dealing or doing a medical legal practice. So legally, the abortion or the miscarriage, another term used almost synonymous with abortion, means the premature expulsion of the fetus from the mother's womb at any time of pregnancy before full term of pregnancy is completed or before the delivery done. And when it comes to medical, in Sri Lankan setup, it's the expulsion of the products of conception before 28 weeks of pregnancy. So for our purposes, medical definition is expulsion of a fetus or product of conception before 28 weeks. But when you are considered legally, it is up to the time of confinement or delivery of the baby. So any thing done before the delivery is considered as an abortion. And it's 28 weeks comes because in our setup, we consider the viability age of viability of the fetus to be 28 weeks. So that's why medically we have set this arbitrary limit of 28 weeks, but in other countries like developed countries, like I say in US, Canada, sometimes uh, this viability age is around 20 to 22 weeks because they have facilities and other things to manage a well very preterm baby. Now, if you classify the abortion, basically you can divide into two: natural and artificial. So, natural one is spontaneous abortion, where due to certain pathological conditions or other reasons, that mother goes into spontaneous abortion. Now, accidental, some authors put it here, right, accidental trauma, because in medical legal view, there won't be any, most of the cases, there won't be any legal consequences. So it is, some people classified it as under natural, but if anyone wants, you can bring it here, doesn't matter. But the only thing is, most of the accidental uh, injuries or traumatic event leading to uh, termination of pregnancy, there won't be any legal consequences. Then totally artificial, the one is therapeutic, where you terminate the pregnancy to save the life of the mother. So the condition to save the life of the mother is the only reason or the condition where abortion is allowed in Sri Lanka. All, everything, anything else other than abortion done to save the life of the mother will be considered as an offense. So all other artificial termination of pregnancies which are considered as an offense, we classify it as criminal abortion. So we call them this as criminal abortion because it's an offense and will be prosecuted under the Criminal Code Procedure of Sri Lanka. So that's why we call that as criminal abortion. So almost all medico-legal issues or cases usually involves criminal abortions for various reasons. Now, when you consider law or compare law among various countries, Sri Lanka's abortion law are among the most restrictive in the world. And attempts at legal reform are held up in parliament for very long period. Once they started or thinking about amending somewhere in 95, 97 era, then even recently, but it had been held up because of this sociological and religious objections to change of any existing abortion law. So, but anyway, yet every day, hundreds of women are thought to obtain illegal abortions, if not thousand, risking their lives and long-term health, and also sometimes many women die out of these criminal abortions. So just to go through the legal provisions in Sri Lanka, so the penal code says of the causing of miscarriage or injuries to unborn children, or of the exposure of infants and of the concealment of birth. This is the section of the penal code that deals with the abortion. So section 303 comes like this, which says, whoever voluntarily cause a woman with child to miscarry shall, if such miscarriage be not caused in good faith, right, for the purpose of saving the life of the woman, be punished with imprisonment of either description of a term which may extend to 3 years, or with a fine, or with both. Now, they say that if the woman be quick with child, it shall be, the punishment will be could be extended up to 7 years, and also a fine, right? So this, now this is a very old law, so therefore quickening or quick child, they consider it to be probably more viable and towards surviving even if it born. So they have the provision to give a more punishment if the woman is quick with the child. Now it has also explanation which says a woman who causes herself to miscarry or does it on her own falls within the meaning of this section. So therefore, if a woman who causes herself to miscarry or abort doing something could be punished according to this law. And the rest of the section from 304 to 307 uh, deals with different aspect of uh, abortion, where 304 is miscarriage without woman's consent, 305 death caused by an act done with intent to cause miscarriage, 306 act done with intent to prevent a child being born alive or cause it to die after birth. Then the last one, the 307, causing the death of a quick unborn child by an act is equal to culpable homicide. So section 303 to 307 deals with various aspects of abortion in Sri Lanka. So you don't have to know these things by heart, but anyone interested can just read it and have a basic idea. Now, if you take abortion policies, as I told you earlier, in Sri Lanka, it is permitted only to save the woman's life. Whereas in other countries, including India, even physical health, mental health, and pregnancies following rape and incest, congenital malformation of fetus, even sometimes economic and social reasons, and countries like states, particularly in the first trimester, even it is abortion on request. So some countries it's very liberalized uh, abortion law, so we have various indications, various reasons to go on with the abortion, but whereas in Sri Lanka it's only to save the life of the mother. So it's easy for you to remember our situation uh, about with regard to abortion law. Now, coming back to criminal abortion, so I told you earlier, criminal abortion is the unlawful expulsion of the fetus by artificial means. Now, it is a felony when any person advises, assists in, or performs an abortion. So, the person who is doing, assisting, all could be prosecuted under this law. And so, as I told you, laws pertaining to abortion remains restrictive, and abortion is illegal unless the life of the mother is at risk. And there may be a provision to carry out abortion uh, to save the life of the mother, considering her psychological or mental status. If some mental or psychological illness, a condition resulting or being aggravated by pregnancy, and if we have enough evidence uh, in psychiatrist assessment and recommendation, there is a possibility that even you carry out abortion to save the life of the mother, considering his mental health, but provided the restrictions in our law have to be very careful, because even the law and sometimes there may could be different interpretations. Now, considering the natural abortions, spontaneous and accidental, and abortion may occur at any time due to natural causes, and abortions occur in about 10 to 15% of all pregnancies, and is most common about the second or third month, that is within the first trimester, and maybe due to advanced maternal age, previous spontaneous abortion, medications, including smoking, um, and sometimes it will be very difficult to find the exact mechanism of abortion, because it's very early fetal development and one will not have much symptoms with regard to pregnancy or even abortion, and intrauterine deaths included. So maternal causes, systemic, something like acute infections, for example, infections like rubella, or even chronic infections like TB, leg toxicity, chronic diseases like hypertension, heart disease, psychological or physical trauma could result in uh, abortion in a systemic manner. Then the local causes like fibroids, pelvic inflammatory disease, endometritis, and uterine abnormalities, particularly abnormality called biconjugate uterus. Uh, it's two parts, and there's not enough space for the child to grow, so that will end up with spontaneous abortion. And then the fetal causes like severe congenital anomalies, intrauterine death, and coexisting hereditary mold which occupies space and also get uh, more of the nutrition provided to baby, and growth of the baby will be retarded and could end up in abortion. And also the placental diseases like conditions like placenta previa and so on. So all these conditions could end up with natural spontaneous abortion. So our problem lies, or we get involved when these someone goes and get a criminal or unlawful abortion done. And most of these unlawful or criminal abortions are also unsafe because they do get it done in unsafe, unclean, unhygienic places. What happened is, as I told you, in our setup, the carrying out abortions are culturally unacceptable, or else it's religious unacceptable. So they don't have a way of getting rid of an unwanted baby, even if the baby is with some congenital malformation or it's a result of a sexual assault, rape. So, and also it has a lot of cultural and religious misconception about safe abortion. So therefore, they don't have uh, no other way of getting this done. So they resort to unsafe abortion practices where the abortions been carried out by unqualified people in places like unhygienic places. So if you just get the statistic of unsafe abortion in Asia, right? Majority of abortion done in safe environment, but nearly close to 50% of abortions are done in unsafe circumstances. And out of this also, this portion is to be considered very, very, or the least safe or most dangerous type of abortion. So roughly about 40% of all abortion done in Asia are done under unsafe condition. But if you take North America, where the abortion is law is more relaxed or liberalized, only a small portion, even including Europe, they resort to unsafe abortion. So this carrying out of this unsafe abortion are the portion that give rise to most complications, death, injuries, and medical legal issues in the country. So you can compare the strictness of the law and the occurrence of unsafe abortions together to get an idea about what will happen in each situation. Now, so when they resort to criminal abortion, there are different methods of procuring a criminal abortion, either from taking drugs in early pregnancy or mechanical intervention in a late, or even surgical and medical methods. So methods used in criminal abortions, one depend on the experience of the abortionist, right? So when you say abortionist, it could be anyone. It could be a fat or unqualified person to a well qualified, experienced person. So you know that if a abortion is done by a well experienced, qualified person, he or she will use the most appropriate method in a safe environment so that uh, complications will be well less, and also he or she won't leave any marks behind or evidence behind to prove the case of abortion. But when it done by effect, method used may not be appropriate to the relevant fetal age, and they will use crude methods which will cause injuries and leave a lot of evidence behind for us to catch him or prove abortion. Then the next one will be the method used will be dependent on the duration of the pregnancy. Earlier the pregnancy, even a oral drugs or small exercise, small things could uh, be useful. But as the pregnancy progressed, we have to use other methods to procure an abortion. So, like methods like oral drugs, usually early in the pregnancy, external methods, injections, and even local irritant applied to the particularly to the vagina and cervix, and instrumental methods are the usual methods that abortion is resort to uh, do an abortion. So orally, that they can use different types of drugs and compounds, ranging from ergot screening, purging drugs, even lead and estrogen and hormonal based drugs to procure abortion early in the pregnancy. And external methods like physical violence, again early in the pregnancy, getting the mother to do strenuous exercise or movement might be useful or may be used to procure a, abortion. And there's a good old days, there's another method called cupping, where you have a candle lit candle fixed on the abdomen and you cover it with a cup. So it goes on burning and create a vacuum and cup get adhered to the abdominal wall, and then the abortion is pulled until it comes off the uh, abdominal wall. At that moment, the abdominal wall will move violently in the opposite direction. So you do it twice, thrice, uh, disturbing the pregnancy. So it may be is successful, may not be. But again, remember that it's a bit a crude way of causing abortion and might lead to unwanted serious complications as well. Then IV injections, including pituitary extracts and even intrauterine saline, which can cause problem in the central nervous system, and different types of prostaglandins, which could be more useful, better than most of the other drugs. Then the local irritants, like you can use these irritants as what vaginal douching or even potassium permanganate or a paste called uterus paste. These things are we now nowadays not seen much in even our setup, but problem is these are irritants or chemical irritants and applied to the vagina and the cervix, which might cause burns and chemical erosion, which could lead to uh, give rise to serious complication, including severe burns or chemical burns and erosion, and might even result in permanent cervical incompetence, so that the woman will not be able to bear a child thereafter. Right. So therefore, when these things done, you get the abortion done, but there be long-term complications, irreversible complications that makes the woman to be fertile or unable to bear a child thereafter. So that is another uh, complications or bad effect of this criminal abortion, that they only want to get this particular pregnancy terminated, but might result in a condition causing woman to be unable to bear a child thereafter. The instrumental method that use different instruments, including from hinge and syringe, curettage, dilators, vacuum extraction, and also penetrating instruments and causing chorionic separation, and even would do this insertion of castoseums, which result in uh, abortion. Right. So again, the use of these things depends on the abortionist experience and qualification, and also the place which it has been done. Like particularly, they use certain things like castoseums and other penetrating instruments, unsterile, which can transmit infection directly to the uterus, causing serious complications. Right, coming to complications, now birth statistics shows that there are about 6.9 million women are treated yearly for complications from unsafe abortions, and more than 22,000 die from complications each year. Right, so that to understand the problem that when they resort to unsafe abortions under restrictive abortion law, it endangers women health because unsafe abortions or criminal abortions are more likely to give rise to serious complications afterwards. Now, complications depend on the method, like if oral or IV drugs used, maybe the toxic effect, particularly uh, substances like which include lead, which can cause lead toxicity and even lead encephalopathy. Then the violent method might result in intra-abdominal injuries due to the use of violence. So there may be injuries even which result in significant hemorrhages inside, and central nervous system lesions, particularly when hypertonic saline is used to cause chorionic separation, where saline gets into the vessels carrying onto the CNS and causing CNS lesions. And air embolism is a serious complications which might end up with death of the woman, where usually they inject air or a fluid which containing air bubble, which inadvertently get into the vessels and getting going and getting lodged in the heart and causing air embolism. And infections like self-anxiety, endometritis, peritonitis, septicemia. So if it goes to septicemia, woman might even die, or something like self-anxiety, endometritis might leave the woman infertile for the rest of her life. And vagal shock, a condition that could result in sudden death, where when they are meddling with, particularly using instruments holding onto the cervix, the could trigger this vagal stimulation, causing sudden cardiac arrest. So that setup, you might not see any changes or injuries due to the act of abortion because the woman dies so suddenly. Then penetrating or instruments, use of penetrating instruments causing injuries to the vagina, cervix, and even uterus could cause uterine hemorrhages and even perforation of vaginal and uterine wall, which could give rise to bleeding and even infection, including even peritonitis. And involution or inversion of the uterus, particularly if vacuum extraction method being used with care, with being careless, and also chronic conditions like anemia could occur uh, following abortions. Uh, so the causes of death depends on the method and the complication, right? Like so, if penetrating instruments used causing damage to the uterine wall and vaginal wall, involving vessels or penetrating into the abdominal cavity, patient could die of hemorrhage and shock, or severe pain causing neurogenic shock due to pain that could also result in death, and less uh, frequent, like occurrence of peritonitis, where particularly the instrument perforating into the abdominal cavity or peritoneal cavity, causing infections. As I told you earlier, air embolism is another known cause of death, and amniotic fluid embolism. So this is another cause of death where when you try to separate the chorion from the wall, where amniotic fluid can get into the mother's circulation and cause amniotic fluid embolism. Uh, Uterine rupture is another series of fatal complications that could give rise to problem. I told you earlier, uterine inversion. So both these are surgical emergencies, and if not treated properly and early, could result in death. And also different complications ultimately affect the kidneys, and patient could die even due to renal failure. And septicemia is another fatal complications that could uh, come up with infections, transmission of infection during the process, and even tetanus and gas gangrene. Now, particularly the gas gangrene, you know that it's caused by organism called Clostridium welschi, where the instruments used to carry out abortion is not hygienic or not sterile, which contain either tetanus bacterial spores or gas gangrene bacterial spores, which is carry on to the tissues during the process, and woman will either develop tetanus or gas gangrene. So tetanus, of course, could be treatable, but if gas gangrene sets in, it's very very difficult to manage because it's now necrotizing condition, and if it sets in, a way of treating is excision of the dead necrotic tissue, but that is very very difficult to go on doing excision of necrotic tissue if it involves the pelvic tissue and the relevant structures. And the other possible cause is poisoning, depending on the drug or the compound used. So, uh, depending on the method of abortion that been used to carry out termination of pregnancy, woman will develop different complications. So if you know the possible probable methods, then you can easily work out and think about the likely complications and the likely causes of death uh, involving criminal abortion. So about the medico-legal management, now in a clinical case, you can examine the mother, right? And when you examine the mother, you can examine for signs of pregnancy, signs of delivery, and even signs of intervention, right? So that will be useful for you to diagnose the woman to be pregnant or had been pregnant, and also uh, the evidence of termination of pregnancy. So, and if the products of conception or the fetus is present, you can examine it to find out about the method of uh, termination, or whether instruments instrumentation being used to terminate the pregnancy. And the mother is dead, then we have to carry out the post-mortem, and sometimes even the fetus or the baby's body is available, that also could be subjected to autopsy, find the method and complications of pregnancy. Now, clinical examination, you have to get the consent from the woman before uh, examination. But if it is an autopsy, it will be a order issued by the inquiry into sudden death, so that you don't have to worry about obtaining consent to perform the autopsy. And as I told you earlier, look for signs of pregnancy, both clinical and autopsy. Right, abdominal, for example, abdominal enlargement, striae, breast enlargement and engorgement, milk secretion, and also the signs of delivery, whether something like bleeding PV, dilatation of cervix, open nose, genital injury, so on, so that to establish or find the signs and symptoms to build up your case. Then the signs of interventions like injuries to cervix, presence of foreign bodies, instrumental marks like sometimes, probably I don't know whether you have seen, we have a specimen in our museum that with a castor in situ, because certain methods or certain things that been inserted to carry out abortion, the abortionists leave it for some time uh, to get the termination done. But then what happened is patient will get up infection and will progress, and sometimes the patient dies. So we'll at the autopsy you might find the uterus or womb with the foreign body inside. Then signs of complications like infections, jaundice, and whenever possible, scene visit is important, because you can find the instruments and other things that been used to uh, carry out abortion, and sometimes even the products of conceptions at the scene of crime, or the where the at the place where the abortion is done, so that you can get that products, and probably do even DNA studies to match up DNA and blood to match up and connect with the particular woman. And in the case of clinical case, even all relevant investigations like blood culture, X-ray, microscopy also could be done to establish the presence of complications and sequelae of a abortion. Right. So if you know the basic law uh, more in our country, and also the basic classification of abortion, and particularly what is meant by criminal abortion, and the methods used to carry out criminal abortions with the possible uh, consequences or sequelae with regard to each type or each method, and uh, probable causes of death with regard to in relation to each of these method and complications. Then you're fine. Then we have a basic idea about how to roughly manage or investigate either a clinical or pathological case of abortion. uh, then you could be able to manage any stuff. And also I think this the basic idea about this would be more than enough for you all to uh, get through the medical legal module exam, right? Because law, you don't have to remember everything. If you just remember that it from 303 to 307, it covers the abortion, and only condition where we permit abortion is to save the life of the mother. So everything could be worked out. Then the different types of abortions, methods, complications, and possible sequelae and causes of death, I think you would be fine. Right. I think that's all. If anyone wants to clarify anything, uh, now it's time to ask any questions if you want.
Excuse me, sir.
Yeah.
If a woman comes and we as a doctor suspect that there is an abortion,
Yeah.
should we report it to the authorities, or
That's
how
right.
we follow up?
According to law, it is not mandatory, right? it's depend on each case, right? Usually, if it is like a one-off case, it's not. I mean, if the woman's life is in danger and she's, I'm like to die or that sort of complaint, then you can consider, because that just depend on the seriousness of the case. But if it is like a mild, just an abortion, and woman is, I mean, having few complication, but it's all right, then you need not. It's not mandatory that you report it to the police, but definitely if you start getting patients from a particular area, so that you have suspicion that there's a fact or abortion is working, then it's better, because otherwise condition the situation get worse, that you might get more and more patients coming in, right? But our law is does not require you to, it's not mandatory you to report all these abortion cases, suspected cases or otherwise.
Thank you, sir.
Anything else?
Excuse me, sir. Sir,
Yeah.
so who are the qualified abortionists and what
No,
are
no,
the
no.
qualifications
No,
of them?
I didn't say that qualified abortion is, right? Now, if it is a criminal abortion, whether it is you are qualified, medically qualified or not, it's an offense, right? And you could be prosecuted. What I meant is some of the abortionists are have they have medical qualifications. Like for example, they might be properly qualified, right? The gynecologist or obstetrician that carrying out abortion, right? I didn't mean that. I didn't mean that there's a category called unqualified abortionist and qualified abortionist, right? If it is unsafe, criminal abortion, right? If it is not done to save the life of the mother, everything, all are situations are considered offense, right? But when you consider the qualification of abortion, one, there may be a group that totally fact they don't have any medical qualification. There's another group which has some medical qualification, some are very well experienced and qualified medically, right? So what you have to understand is that criminal legal aspect is different, but when you consider the methods used and the complications, when the person who carry out the abortion is well qualified medically and well experienced, then they will use the most appropriate method at the appropriate time. And probably it's very, very difficult to track down or find any evidence of abortion being carried, right? So that is what I meant by qualified and unqualified. But when it comes to an offense, someone has committed an offense, then you can't claim that one is qualified, other one is not qualified, right? What I meant is the pure qualification of a person who's doing the abortion, because then it will, I mean, they will use the appropriate method for the appropriate the period of gestation to leave, do it properly, do it safely, and also leave out or not to leave out any evidence of abortion being done.
Okay, sir. Thank you.
Anything else? Okay, then is it alright if I terminate the session, right? So I will get this presentation PowerPoint also uploaded to LMS possible, so that you can read it slowly, read it again, right? Okay, then thank you for joining. Good day to you all.
Thank you, sir.
Right, so I will end the
Okay.
meeting. Thank you.
Thank you, sir.
Thank you, sir.